Hey everyone, this is Arun. I'm a certified professional coder. In this video, we're going to see how to code for colonoscopy procedure. Before moving to the coding colonoscopy, we should know the anatomy of a large intestine. A large intestine consists of cecum, ascending colon, transverse colon, descending colon, sigmoid colon, and rectum. What is colonoscopy? Colonoscopy is a medical procedure in which the physician inserts a long, flexible, tubular instrument called a colonoscope into the patient's anus to examine the lining of the entire colon for abnormalities and disease conditions. How do we know that people have high risk of getting colorectal cancer? If they have one or more of the following: a close relative who has had colorectal cancer or adenomatous polyp, a family history of familial adenomatous polyposis, a family history of hereditary non-polyposis colorectal cancer, a personal history of adenomatous polyps, a personal history of colorectal cancer, inflammatory bowel disease, including Crohn's disease and ulcerative colitis. Is there an age criteria for doing a colonoscopy? The answer is yes. Medicare coverage for preventive colonoscopy applies to patients aged 50 years and older. As of 2022, the majority of commercial insurance covers screening colonoscopy for patients aged 45 years and older, and few payers cover even earlier for individuals at high risk of colorectal cancer. Is there a frequency for doing a colonoscopy? Yes. As per Medicare, Medicare covers screening colonoscopy for patients at normal risk for colorectal cancer once every 120 months. That's once in 10 years, or 48 months after a previous sigmoidoscopy, and every 24 months for patients who are at high risk and or require surveillance after findings from a previous screening. Count begins with the month after the month in which previous test or procedure was performed. In other words, if the procedure was performed in March, begin counting from April. What is screening colonoscopy? Screening colonoscopy that is routinely performed on an asymptomatic person. Asymptomatic means there is no symptoms, for the purpose of testing for the presence of colorectal cancer or colorectal polyp. Diagnostic colonoscopy is performed when the patient has physical symptoms such as rectal bleeding or pain, and the test is necessary to either rule out or confirm a suspected condition. Therapeutic colonoscopy is performed when the abnormalities are treated for the purpose of biopsy, tumor ablation, or other therapy. Surveillance colonoscopy is when the patient is asymptomatic but has a personal history of gastrointestinal disease, colon polyps, or cancer. Technically, this is a screening test with different diagnostic coding and frequency guidelines. For Medicare patients, report HCPCS Level 2 code Z0105 and Z0121 based on the risk factor. If patients are at high risk of colon cancer, then code Z0105. If individual not meeting the criteria for high risk, then code Z0121. For commercial and Medicaid patients, report CPT 45378, colonoscopy flexible diagnostic, including collection of specimens by brushing or washing when performed. For commercial payers, when the reason for visit is preventive, add modifier 23. Modifier 23 allows you to tell the payer that the procedure was performed for preventive visit. and it will waive the patient's deductible and co-insurance. Modifier 33 is not used for HCPCS level 2 code G0121 or G0105 since screening is already indicated in the code description. For Medicare payer, append modifier PT when a colorectal cancer screening test is converted into a diagnostic or therapeutic procedure. This will not waive the patient's 20% coinsurance or copay, but it will waive the Medicare's deductible. As per ICD-10-CM guidelines, a screening code may be first listed code if the reason for the visit is specifically for the screening exam. That code would be Z12.11, encounter for screening for malignant neoplasm of colon. According to ICD-10-CM coding clinic, whenever a screening exam is performed, the screening code is first listed, even if an additional procedure is performed as a result of the screening. In the event a screening turns diagnostic, also code the findings. If colonoscopy procedure was discontinued by the surgeon due to various reasons, then add diagnosis Z53.8, procedure and treatment not carried out for other reasons. To indicate a screening colonoscopy is for surveillance of a previous problem, be sure to report the applicable history code. Here we have a decision tree. Based on this decision tree, we can accurately code the colonoscopy procedure. First, we have to identify whether the colonoscopy was done for diagnostic purpose or therapeutic purpose. If the procedure was done for diagnostic purpose, check where the scope is reaching. If the scope does not reach splenic fracture, then code flexible sigmoidoscopy. The procedure code is 45330. If the scope is beyond splenic flexure but not to the cecum, then code colonoscopy CPT code 45378 with 53 modifier. If the scope reaches to the cecum, then code colonoscopy CPT 45378 with no modifier. If the procedure is done for therapeutic purpose and the scope does not reach the splenic flexure, then code flexible sigmoidoscopy 45331 till 45347. If the scope reaches beyond the splenic flexure but not to the cecum, then code colonoscopy procedure 45379 to 45398 with 52 modifier. If the scope reaches to cecum, then code colonoscopy 45379 till 45398 with no modifier. Here I have few examples to share with you. The first example is a 70-year-old Medicare patient called the surgeon's office and requests a screening colonoscopy. The patient's previous colonoscopy was at 59 years old and was normal. The patient has no history of polyps or colorectal cancer, and none of the patient's sibling, parent, or children has history of polyps or colorectal cancer. The patient is eligible for screening colonoscopy, and what would be the correct code with diagnosis? The answer is Z0121 and Z12.11 because here we have like the patient is a Medicare patient, right? For Medicare, for screening colonoscopy, we have only two codes. One is Z0121 and another one is for high risk. Here they have mentioned like the patient does not have any previous history and there is no family history. So the patient not meeting the high risk. So the correct HCPCS level 2 code for this scenario is Z0121. And this is for the purpose of screening. So the correct diagnosis is Z12.11. Here's another example. Here a 52-year-old patient calls the surgeon's office and requests a screening colonoscopy. The patient has never had a screening colonoscopy. The patient has no history of polyps, and none of the patient's siblings, parents, or children has a history of polyp or colon cancer. The patient is eligible for screening colonoscopy. What would be the correct procedure and the diagnosis code? This is the same scenario like the previous one, but the only difference is this patient is not a Medicare patient. So the correct code is 45378. Colonoscopy flexible diagnostic, including collection of specimens by brushing or washing when performed, and this is for purpose of screening. So the diagnosis is Z12.11, encounter for screening for malignant neoplasm of colon. Here we have another example. Here a Medicare patient with a history of Crohn's disease presents for screening colonoscopy. Her most recent screening colonoscopy was 25 months ago. No abnormalities are found. What would be the correct code? The correct code is Z0105 with DX Z12.11 and K50.80, because here we have the Medicare patient. For Medicare patient, we have only two codes for screening colonoscopy. One is for high risk and one is for medium risk. We know how to check for high risk. We have a few things to check for high risk. Here they have mentioned like history of Crohn's disease. So the patient is at high risk. So the correct HCPCS level 2 code is for Z0105. And also they have stated like the previous colonoscopy is done before 25 months ago. So it satisfies the Z0105. And the correct diagnosis code is Z12.11 for screening for malignant neoplasm, and they have also mentioned like history of Crohn's disease. So for Crohn's disease, the correct DX is K50.80. Here we have another example. A 52-year-old patient calls the surgeon's office and requests a screening colonoscopy. The surgeon removes a polyp with snap technique. Previously, we have seen like a provider done a screening, but there is no polyp removal. But this example, the provider removes a polyp by snap technique. So the correct answer would be 45385 with 33 modifier, and DX is Z12.11, and another DX is K63.5. Here the screening was converted to a procedure, therapeutic procedure. So we are adding 33 modifier with the procedure, and we are coding Z12.11 because of screening for malignant neoplasm of colon, and provider removes the polyp from the colon. So we are adding another DX K63.5. Here we have a last example. A patient with 52-year-old calls the surgeon's office and requests a screening colonoscopy. Due to poor prep, procedure was discontinued and surgeon planned to do it after 1 week. What would be the correct codes? Here, the correct code is 45378 with 53 modifier because the provider discontinued the service because of the poor prep. So we are adding 53 modifier with the procedure 45378. And the correct diagnosis is Z12.11, encounter for screening for malignant neoplasm of colon. To indicate that the procedure was discontinued, we are adding an additional diagnosis Z53.8, procedure and treatment not carried out for other reasons. Thank you for watching the video. If you have any comments, comment below, and if you have any doubts or if you need any billing service, contact my email. It's in description box. Thank you. Have a great day. Bye-bye.